Globally, more than 2 billion people struggle to access the most basic forms of imaging, according to data provided by the World Health Organization.
Radiology is expensive. It's expensive because technology is expensive. But I don't think we should be too pessimistic about it, because there are companies now coming up with high-end equipment at pretty low prices, which work really well. The only problem that I see is that in Kenya, it's all centered in the big cities. So, if you come to Nairobi, you can get the best of care. And we really need to take it out to the rural areas now, which is beginning to happen, and we're really pleased about it. But I think in the main centers, the main cities, it is excellent.
And with technology which gives you the ease of seeing as many patients as possible and giving the most accurate of diagnosis, that's the most important thing when it comes to diagnosis. Everybody wants to get treated easily and quickly, and also get the best of the results from the diagnosis.
Kenya is also said to be suffering from an acute shortage of specialists in diagnosis, as well as high technological machines to facilitate basic healthcare services.
There are 38-40 million people in Kenya, and there are 165 radiologists. Out of the 165, about 135 are in 3 or 4 major cities. So you can imagine how many are out in the rural areas. If you look at Western standards, we should have 5,000. Not 165, but we won't reach those standards that quickly. But there are new centers of training being set up. But even so, we're only producing about 20 a year. There'll always be a shortage of radiologists.
If you have a proper training in place and you have the right product, which is easy to interface with, then you open a world of opportunities to the medical field.
The Kenya Society of Ultrasound in Medicine and Biology is targeting to rein in on quacks who purport to carry out tests, yet they are not qualified, resulting in either death or wrong treatment.
We must look at quality assurance measures, because there's no point of having a facility somewhere if they're not doing quality work. There are some people who are not adequately trained. They've set up centers. They give you a diagnosis, but can you really trust it? So what we've been doing is we've started a process whereby we will accredit centers where scans are done. If we find that they are substandard, we're offering services whereby they can come, have a refresher course, learn new techniques, and then go back and offer a good service. It's not done on a commercial basis. It's purely to improve quality.
The scientific conference comes at a time that Kenya and the world at large is marking October as the Cancer Awareness Month. Josephine Wawera, GBS.